Could your symptoms be telling you something important? As we journey through life, our bodies change in subtle and sometimes not so subtle ways. For men, one of those changes often involves a small gland that many don't think much about until it starts causing trouble: the prostate. Sitting just below the bladder and shaped somewhat like a donut, the prostate wraps around the urethra, the tube that carries urine out of the body. And like many parts of the body, the prostate doesn't always stay the same. As men age, this gland often begins to grow, slowly pressing against the urethra and making it harder for urine to pass. This condition is known as Benign Prostatic Hyperplasia, or BPH. It's not cancer, but it can significantly affect quality of life. So how can you tell if you might be dealing with BPH? Here are the 5 key warning signs that your prostate might be enlarged and what they could mean for your health. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe to the channel so you never miss proven, practical health strategies designed for your golden years. 1. A slowing stream. One of the earliest and most commonly noticed signs of an enlarged prostate is a weakened or reduced urine flow. What used to be a strong, forceful stream becomes slow and sluggish. You might find yourself standing at the urinal far longer than other men around you. In fact, many men report noticing this at public restrooms. Others come and go while they're still waiting to finish. It's not just inconvenient, it's a sign your bladder is working overtime to overcome an obstruction. 2. Hesitancy. You feel the urge to go. You walk up to the toilet, and nothing happens. This frustrating delay, known as hesitancy, can be both confusing and concerning. Even though the need to urinate feels urgent, the stream doesn't begin right away. This is because the prostate is compressing the urethra, and the bladder has to generate extra pressure to start the flow. It's a classic hallmark of BPH, and one that many men simply chalk up to getting older, but it doesn't have to be accepted as normal. 3. Intermittent flow. Here's another red flag: urine that stops and starts midstream. You may begin peeing, only to stop unexpectedly, then start again a few seconds later. This pattern, called intermittency, indicates the bladder is struggling to maintain consistent flow against the resistance created by the enlarged prostate. It can be frustrating, time-consuming, and another clear signal that your urinary system is under strain. 5. Frequent urination, especially at night. Now we shift to what doctors call irritative symptoms, and they often stem from the bladder itself. As the bladder works harder to push urine through the narrowed urethra, its muscular wall thickens, becoming less elastic. The result? Frequent urges to urinate, even when the bladder isn't full. You may find yourself making trips to the bathroom every hour during the day. Worse yet, you may be waking up several times a night, something known as Nocturia. While getting up once during the night can be normal, needing to urinate multiple times disrupts sleep and can leave you feeling exhausted. This is often the symptom that drives men to finally seek help. Urgency. When you've got to go, you've got to go. Perhaps the most telling and troublesome sign of BPH is urgency, a sudden, overwhelming need to urinate that feels nearly impossible to delay. For some men, it gets so bad that they leak urine before they even reach the bathroom, a condition called urge incontinence. Urgency suggests that the bladder is becoming unstable, likely due to long-standing pressure and thickening of the bladder wall. It's a strong signal that the prostate is no longer just a little enlarged. It's seriously interfering with the body's ability to manage urine. At this point, conservative strategies like just drinking less at night may no longer be enough. If you or someone you know is experiencing any of these 5 symptoms, slow stream, hesitancy, intermittency, frequent urination, or urgency, it may be time to have a conversation with a healthcare professional. While BPH is common, it's not something to ignore. Left unmanaged, it can lead to bladder damage, infections, or even kidney issues. The good news? There are a range of treatments available, from lifestyle changes to medications to minimally invasive procedures that can significantly improve quality of life. If this video helped you better understand the warning signs of BPH, give it a thumbs up, hit that subscribe button, and consider sharing it with a friend or loved one. If you have a story, question, or experience related to prostate health, drop it in the comments below. You never know who else might benefit from your insight. Thanks for watching, and until next time, take care of your prostate.